Hello, I am Dr. Namrata, Chief Fertility Specialist, Universal Srushti Fertility Center. Actually, I want to tell you the importance of age in treating fertility problems. Suppose a person has got married 1 year back and till now the couples have not conceived. No abortion happened. No pregnancy happened, no ectopic pregnancy happened. Then the people are together, the couple is together. They both are having normal sexual life without any failure. Even then the couple has not conceived. So why we should bother about the age? Age is very important because after maturation for a female, it may take around 15 years per se. So, once the female attained maturity, after that from 16th year to 25th year, the person will have 100% conception capacity. That means the fertilization will occur and then the embryo will form. After that, the embryo will come and get attached into the endometrial cavity. So, that is called conception capacity. So, in between 16 to 25 years, there will be 100% conception capacity. After that, 25 to 30 years. In between that age, the conception capacity, that means the implantation capacity inside the endometrium, the embryo will get attached in the endometrial cavity and it starts growing. So, that is called implantation and growing capacity of the embryo inside the endometrial cavity. So, that means what we should do in 25 to 30 years age, that capacity is going to decrease up to 60 to 70%. So, 30 to 35 years age, then what will happen? After in 30 to 35 years age for a female, the conception capacity will decrease still more, it will be around 40%. After 35 years, what will happen? After 35 years, the conception capacity in a female decreases some more, it will be around 10 to 20% only. Without treatment, it will be very less, 10 to 20%. You imagine 100%, but this 10 to 20% is very, very less. So, what will happen after 40 years? After 40 years, it may be up to 5 to 10%. So, if we don't give any treatment, they may not have children.